Thank you, Dr. Rai sir. Thank you very much for these kind words. Of course, a big thanks to Manoj Purvi Bansi. And probably my best introduction would have been student of Boroskar sir. That is adequate to me. If I am standing here, I am standing completely as student, completely bowed to him, humbled by his presence. And of course, thank you all of you for this. In next 5-7 minutes, what I'll do is this, that we, Association of Physicians of India with Team Glenmark. This talk is by the educational grant by Team Glenmark. So we tried to come out with a very early consensus on role of liraglutide in diabesity. We knew that liraglutide actually was one of the first GLPs, and I believe that you are all are adequately inclined. So in these 4 or 5 points, I'm just going to give you what API thinks about liraglutide as a molecule, and especially the biosimilar liraglutide that we have. Because we need to understand that diabesity is an overall challenge, and that has been taught to us by Boroskar sir right from the time that I started learning about diabetes. It's not just sugar that you are wondering. Along with that, a weight challenge, which is an absolutely continuous dynamic relationship. Now, it's a chicken or egg situation, but majority of the times, they are both the poison fruits of the insulin resistance. So now globally, as we get sensitized about managing overweight and obese people more adequately, we need to also understand that at the same time, we cannot forget about managing glycemia adequately. So these are all unmet needs that diabetes patients have, and one of that challenge was always obesity. And you all have heard about this, all this congress and majority of the prior congresses also, so I'm not going to dwell into it. But liraglutide was one of those drugs which was that time available for us to manage our diabetes and obese patients. And we know it is a long acting drug, not actually once in a week, but it is everyday drug, and is not only effective in controlling the glycemia, but is also very effective in controlling your weight. Now, how much is the weight loss which is expected when you want to actually start thinking about having an impact on the glucose control? How much is the weight loss which is expected? 5%, right? The moment you achieve a weight loss of 5% and you start going above 5%, you start getting that benefits of glycemic control, reduction in the inflammation, and the other challenges. Now, liraglutide is one of that kind of drugs which Glenmark came out as a biosimilar, as a most cost-effective therapy. Dr. Makkar sir, belated happy birthday to you. And we know that biosimilar liraglutide is not inferior to the innovator molecule. And PKPD studies are available. I will not go into the details about it, but there is very interesting phase 3 study which was conducted to see that whether the biosimilar liraglutide was equally effective or as effective as the original one or an innovator one, and they looked at both arms, 128 patients, and they looked at the fasting and a prandial and an A1C reduction and the change in the body weight. And you can clearly see that both innovator as well as the biosimilar brand, they did exactly well at the end of 6 months or 24 weeks. Not only that, there was also a significant weight loss of around 2 kgs. And there was no significant statistical difference between the innovator brand and the biosimilar brand. A very interesting study which was called as GRADE, which was studied and which looked at 4 different molecules. They looked at gliptins, they looked at sulfonylurea, they looked at GLP-1 receptor agonist, and they looked at basal insulin glargine on a background of a metformin therapy. And they tried to find out which is the least risky one as far as hypos are concerned, and which will confer the best weight benefit. And no rocket science, you know that liraglutide turned out to be one of the best. So talking about liraglutide in type 2 diabetes and obesity, this is an ADA consensus 2025 statement which says that if you want to achieve a very high weight loss, of course you have got SEMA and now we have got tirzepatide. But if you want to achieve a high weight loss or a moderate weight loss, probably dulaglutide, liraglutide can be easily given to the patient, to non-affording class of the patients, those who want to lose weight but cannot afford the costs of these expensive drugs. Probably this drug can be one of the best addition with minimum possible, I would say, cost challenge in that. And I'll say that there is an adequate data which is available as far as the effectivity of liraglutide as far as the weight loss is concerned. Liraglutide also has got a significant impact as far as the MSLD is concerned, and I'll not go into the details about it. As all GLPs, Lira also reduces down the incidence of NASH and further hepatic complications which are related to inflammation. Coming to the cardiorenal benefits, I am rushing through the slides because time is just 10 minutes. And if you look at all the outcomes of all the GLP trials, including LEADER, SUSTAIN, EXCEL and all those, and if you look at the MACE, if you look at the cardiovascular death, you'll realize that there is a good amount of benefit of around anywhere in the range of around 13 to 17% to up to 20%. So that means that 1 in every 6 or 7 patients are going to get benefited as far as these outcomes are concerned. Myocardial infarction and interestingly stroke, they go down. A very interesting Chinese study which was called as a LAMP study which was done, and they looked at almost 700 patients, and what they looked at, fresh stroke, hemorrhagic stroke, and the patients those who already had a TIA, whether they develop a new stroke. And look at this, the people on liraglutide in comparison to the comparators, you'll see that there was a significant reduction in the incidence of the stroke, which is for the first time. And now all the GLPs now started demonstrating that, but Lira was the first molecule to demonstrate that it has an ability to reduce down on stroke. Coming to the management of diabesity, we need to understand that API also, in the leadership of Professor Dr. Milind Nadkar, Dr. Girish Mathur, Dr. Agamora, I was also a part of it. We wanted to convey this message to the physicians that liraglutide biosimilar is extremely beautiful drug which is available for the physicians to manage not just diabetes but related diabesity challenges including the inflammation. So it is effective in controlling diabetes. It is very effective. It can cause around 7 to 12 kgs of weight loss in those patients, those who respond beautifully. The risks are much lower. The gastrointestinal side effects are comparable to almost all the GLPs and overall settle down beautifully well. But what is most important, which is extremely important as far as the Indian part of the story is concerned, is this, that it is very, very affordable. It's extremely affordable drug. Start with priorly 0.6, go to 1.2, step up to 1.8, and that transition becomes extremely easy and very, very beautiful. Thank you very much for this wonderful opportunity, sir.